if a woman has had estrogen positive breast cancer, she can still use estriol vaginally. It does not get systemic. It does not cause systemic estrogen. It is not contraindicated in a woman who's had breast cancer, and it's very effective. Hello, I'm Dr. Mona Morstein. Welcome to my channel. If you haven't subscribed, please click on the button below. All right, women, get your blush on. We're talking about vaginal atrophy. Menopause, by definition, is when a woman hasn't had a period for a year after, of course, she started it. And generally, the average age of menopause is around 52. Now, menopause is not a disease. It's a normal transition in a woman's life, right? It innately does not need to be treated. There are, however, symptoms that might develop that do need to be treated in a woman, okay? Now, I've spoken plenty about menopause and bioidentical hormones and menopause and sleep and other aspects of menopause, but we're focusing today on the vagina. The lining of the vagina requires estrogen to stay thick and moistened and be able to lubricate well. So after menopause, in some, but not all women with making less estrogen, which is the key aspect of menopause, then the vagina, without that estrogen stimulation, can become very dry and thin and not lubricating. Now, this can be irritating just to a woman walking around saying, is it dry in there? What is that? That doesn't really feel good. And what can also be a problem is there can be significant discomfort with sexual intimacy, that without the lubrication, that there can be pain, there can be even tearing and bleeding. That friction of intimacy cannot work for many women postmenopause with the low estrogen. This is one of the most common things I treat in postmenopausal women. What are the ways we can work with it? Well, we can start with vaginal moisturizers. These are things over the counter like Replens. Now, Replens was actually in a study with estrogen cream, and it showed to be the same effectiveness, right? I don't actually think it's the same effectiveness, but if there's some reason we don't want estrogen, shouldn't be any reason, then Replens or other moisturizer, what they do is they temporarily add moisture to the lining of the vagina. And generally that needs to be done twice a week. Then there are water-based lubricants. My favorite, I like Emerita, but there's Good Clean Love, there's Astroglide, there's S-Liquid, loads of companies. Now, this is also good to apply to the partner so that it has easy friction. These are much better than some of the other brands that wear off quicker. Emerita doesn't wear off well with the friction of intimacy. And neither do the other brands, I think. But that combination of making sure the vagina is built up and we have a better lubricant, it's a very, very good combination. Some people take, estrogen systemically, right, whether oral or topical. And that can work for the hot flashes and the headaches and things that can come with menopause, but it's not necessarily going to be that effective for the vagina, right? In some women it works, but in many women we really need to address the vagina through the vagina. And so for this, there are prescription creams like prescription estrase, for example, right? Which is bioidentical estradiol in a cream. Me, I like Estriol, right? Estriol is the weakest estrogen. But it's super great for the vagina. And we can get it in either a cream or we can get it in a suppository. Now, the creams are cheaper, But to me, patients complain about having to clean the applicator and use it. And the suppositories, right? Pretty easy. Peel, insert. There you go. Back to life, right? Generally, for all of these, we tend to do insert once a night for about 10 days, sometimes 2 weeks. And then after that, it's just 2 or 3 times a week. Whenever a woman feels, it's getting a little dry down there, I think, right? So then just you can insert again, but you don't need it more than that. The estriol comes generally doses 1 to 2 milligrams. Estrace is 0.01%. There's also vaginal estrogen rings like E-string or Femring. There's a vaginal estrogen tablet prescription called VegiFem as well. There's also Osphena, which is an oral daily pill, but contraindicated with breast cancer. I've never seen any woman on that. I've never prescribed it. One thing I want to say about estriol in the vagina. Estriol in the vagina is kind of like those Las Vegas commercials. What goes in there stays in there, right? So if a woman has had estrogen positive breast cancer, she can still use estriol vaginally. It does not get systemic. It does not cause systemic estrogen. It is not contraindicated in a woman who's had breast cancer. And it's very effective, just to let you know that. Now, other things, there's vaginal DHEA called Intrarosa. DHEA breaks down to testosterone and estrogen. Why not just give the estrogen? Your testosterone doesn't help your vagina, right? But does it help your libido? Maybe we could do that topically. But what your vagina needs is estrogen. So just give estrogens, right? There are also vitamin E suppositories that can be compounded and used. And then there are companies now that are, I don't know how it's legal because it's not. Estriol is not really legal over the counter, but I'm seeing more companies that have estriol that they're putting out on the internet, and some of them have vitamin E added in, and they have aloe added in, and other things along those lines. I still think it's good to be under a physician and get it properly compounded. You also know for sure what's in that versus maybe some supplement that shouldn't be sold over the counter. Those are the things so that we use generally, though, with the estrogen. I mean, within the couple of weeks, a woman is like, that vagina has returned to normal. And it's really great for herself and also for connecting with her partner. Another thing to consider regarding the vagina postmenopause is that the vagina postmenopause can kind of start shrinking up. The entrance to the vagina can shrink, the vagina length and so forth can shrink. And so sometimes it's good to use vaginal dilators, right? And these stress the vagina as stretching the entrance so that larger items can be inserted and stretching the rest of it as well. Now, dilators can start very small and then they just titrate up in size. It can oftentimes be combined with pelvic floor therapy if there really is a problem with a woman down there in that regard. I recommend the silicone sets from companies like Intimate Rose. Just a very great collection of different sized vaginal dilators. So, with these methods, vaginal atrophy can be effectively treated so that a woman is comfortable with her own vagina and sexual intimacy can be maintained and enjoyed throughout the years of her menopause. Hey, I guess we're all blushing. That's the way, but we have to talk about this. Nobody talks about this. Someone has to talk about this. It's really important. So I hope you've learned a lot. I'm Dr. Mona Morstein. I look forward to seeing you in the next video.